Good morning, Chair Umberg and members. My name is Dr. Letitia Edwards, and I'm a pediatric dentist in Los Angeles, California, and the chair of the California Dental Association Governmental Affairs Council. As a clinician and on behalf of my dentist colleagues across the state, I'm here in support of SB 351 and to share my experience about what happens when decision boundaries are crossed by private equity in clinical practice. Patients put their trust in their doctors to do what's right for their care. Dentists are held to professional and ethical standards to ensure patient care remains in the hands of qualified practitioners and that trust is protected. With SB 351, we're asking that California law explicitly regulate the increasing involvement of private equity and hedge funds to keep those investors out of the clinical lanes. This bill is especially timely and necessary for dentistry, as dental office acquisitions outpaced mergers and acquisitions of all other medical specialties in 2024. I currently practice in 3 different offices, 2 of which are corporate practices, and 1 of which is private equity backed, so I have experienced some of the pressures private equity firms can put on dentists to maximize profits. As a dentist, only 2.5 years into my career, many of my early career colleagues share the similar ways they feel trapped by the production goals set for them by private equity firms. Newer graduates have an average of nearly $500,000 in educational debts and are attracted to the availability of positions in corporate practices. Graduates who are offered these jobs don't always know that a practice is private equity backed, and it can feel challenging to push back on production expectations which don't align with the standard of care which we learned in dental school. Whether it's patient quotas, which limit the amount of time which we're able to spend with our patients, or encouragement to over-treatment, plan unnecessary x-rays, cleanings, or restorative work, PE has the ability to influence and apply pressure to a dentist, which ultimately can compromise clinical decision-making and professional integrity.